Hello, and thank you for joining me as we continue to tackle cardiovascular disease. This segment is on lipoprotein A, Lp(a). Very important that we take a close look at this. Now, here we are again inside that blood vessel wall. We don't want to get away from that picture. And we have our blood vessel wall thickening, narrowing, or if you will, occluding itself, right? And we can have plaques forming over here. Why is lipoprotein A so dangerous? Number one, there are no really known medications that can help decrease Lp(a), but in this segment we're going to introduce you some very powerful enzymes that have been shown in data to begin to strip lipoprotein A. Inside the wall here, I want you to see this, and I'm drawing this to scale so you can understand it, but I'm going to draw this square that's connected here. Imagine a subunit of Lp(a) attached to the blood vessel wall. It's like Teflon tape, and it's further narrowing the blood vessel. And in fact, you can see we've labeled it here Lp(a) inside so you can see it. And what's happening is this is it's stuck. It's stuck to the blood vessel wall. It's narrowing it. It's much worse than cholesterol. It's many times more adhesive and sticky. It's very sticky to, you can see it in here, it's very sticky to, so what do we do for Lp(a)? Number one, you can get tested. You can run tests for Lp(a), and it gives you an idea of how much Lp(a) is playing a factor in your heart disease. And I'm going to tell you, if you have genetics in the family that are at risk for heart disease, almost always we see in the clinical situation the Lp(a) is elevated. So simply, there is not a lot of things you can take, supplements and so forth, that help Lp(a). However, we have a particular enzyme that has been researched, that has been used out of Japan called Buluki-lumbrokinase. It's an enzyme made from the worm. And the Buluki-lumbrokinase enzyme in data has shown to begin to strip this Lp(a). So in the clinical data, as patients have taken the Buluki-lumbrokinase, their Lp(a) has gone down in number. And we've seen this in a small little trial, but it's promising going forward in the future as we're looking at new ways to help cardiovascular disease. Amongst many other wonderful things that this lumbrokinase can do is also strip the fibrin. Now, I want to show you very quickly, in the Lp(a) attaches to the fibrin. I'm going to mark these out along the outside of the blood vessel wall. The Lp(a) attaches to the fibrin on the blood vessel wall, which is being laid out, and as the thickening, as we're having a problem in this blood vessel wall's coagulation, we see the fibrin thickening and the Lp(a) attaches to it. So Buluki-lumbrokinase does a good job of stripping, decreasing the Lp(a), and also impacting the fibrin. This is really, really important because this also, as we talk about, leads into the viscosity of blood. This makes blood thicker, harder for the blood to pump through. And if you can see here in this animation, as the blood vessels are going through, they get sticky, and they kind of stick along the way here. Okay? So thank you for joining us on this segment of the Envita Whiteboard. Lipoprotein A, folks, really important stuff for cardiovascular disease, more important than cholesterol, and a factor we need to get tested, and then we can use natural things to help us to make a difference with our Lp(a). Thank you.